handling any documents or submission to the MMC. Okay, nowadays it is all online. Okay, and they will open. In fact, the last one they opened was on the 6th of August, which is the 4th intake for the year, house officers. So the moment they open, or they will tell you beforehand, they give you a time frame of several hours, okay, for the day to enter all the documents. And you can go, there are two platforms, okay. One is called Merits, okay. You can go to the internet, and you can put there MERITS, Merits, okay. Either that, or you go to eHouseman Malaysia. Okay, both will take you to the same website, where there are columns to fill up: your name, your age, and when you passed the examination, when you got your certificate, and so on and so forth. Okay, and this all comes under first come first served. If you have whoever you have entered, and you got all the documents to upload, like your copy of your passing certificate and your MBBS certificate and so on, okay, which you need to upload. And we already bundle and keep it. When they open that, you just enter it. So what happens is that it is purely by chronological order. Okay, whoever submitted first, they are going to get, okay, regardless. They don't have any such thing as what they call public universities and private universities. There's no differentiation. If they are late, they got a problem. In fact, what happens is that Manipal will give a certificate, passing certificate, copy of it before the convocation. Whereas, like some of the public universities, they only give it on the day of convocation, which may be several months later. And in fact, because we are giving us the certificates earlier, even before the convocation, we have an advantage over the many public universities, because they got all the certificate to submit beforehand. So this it is, I don't know why they had this perception is wrong, that whether you are coming from abroad, whether you're coming locally, whether you are locally private or public, it doesn't matter. Whoever submitted it first, and you are dealt with, you given a job first. Yeah.
Thanks, Prof. Okay, and then Prof, I have got another question. Okay, when once the students are in housemanship, okay, are there any marking system, and do they need to score again, and who will give them the marks? And does the marks, like say a student scores flying colors, does he got any advantage? And if a student were to get lower marks, why is it so?
Okay, it's a very good question. Okay, you are constantly monitored, because when you start in the government after passing your MBBS, you have to do a 2-year housemanship, and during this 2-year housemanship period, you are monitored and on your progress, and the report is given by the head of the department. While you're doing house officer's job, for every 4 months they will send you a different department. For example, you may start with the Department of Surgery, then you may go to a Department of Obstetrics and Gynecology. Next, you may go to a Department of Internal Medicine, and so on. So there are 4 monthly rotation. If you don't perform well, or you're not progressing well, okay, then the worst come scenario is that they may ask you to repeat maybe extra 1 month or 2 months in that particular department or discipline. Okay, but suppose you accumulating a lot of these repeat or extra postings. Okay, the totally you cannot exceed more than 3 years to do your housemanship. Okay, it is the interest that you finish your housemanship within 2 years and without any black marks. Usually the black marks are you don't come in time to work, okay, and then when you are called for duty, you come late, okay, you are not contactable, you are very rude to the patient, okay, these are the 90% of the complaints. Whoever had complaints are actually on these communication skills and attitude problem. Okay, and if I think in the future is for doctors must specialize. If we are going to take a lot of black marks during a housemanship period, okay, you may not get masters or specialization program. Okay, so it is your interest that you have a good attitude and the work culture. Okay.
Okay, doctor. Thank. Okay, doctor. After the housemanship, what is the procedure for a doctor or for a medical student to get his license, and which is the governing body, who would offer them the license, and what are the conditions for them to hold the license? And then after the housemanship, how soon a student can get specialization education, and what is the actual procedure? Why some get, some don't get, and what are the actual requirements? Actually, which body or who are the doctors or professors actually in charge of offering the housemanship, and how does the monetary part work, scholarship? I mean, where are they going to go for money, for their specialization, and where to go, overseas or local, all these doctors?
Okay. Earlier, you also asked me one more question, which I think I didn't answer. That was who applies. Actually, the individual applies to do housemanship. When you go to the website, okay, there's a form to be filled up by the individual, but you would collect the college aids helps you to get all the certifications and documents necessary for uploading, okay, beforehand. Okay, when they write to us or when they pass, we will prepare all the documents and give it to you, and the uploading has to be done by yourself. Okay, that's one I didn't tell you. Okay, that's number one. Number two is that our system is a bit different from the other countries. Almost all the countries in the world, they have 1 year housemanship. Okay, whereas in Malaysia we have a 2 year housemanship. When I did my housemanship in Malaysia, that was about 45 years back. Okay, and I did only 1 year. Okay, but in the last 15 or 20 years, what has happened? There were a lot of shortage of doctors at that time. Okay, and they said just to have extra hands, okay, in the hospitals, they said we will have 2 year housemanship. Okay, that's number one. Once you finish your 2 year housemanship, they also have a compulsory service because of the shortage of doctors. Okay, so they have 2 years compulsory service. If even if you want to come out, you cannot come out. Okay, that was the rules, regulations, that you must have 2 years of compulsory service. And now what has happened? You asked me about your postgraduates. If you want to do a postgraduate, whether locally or abroad, they will want 4 years of medical officer's experience. If they're only giving you 2 years, and if they're not going to give you another 2 years, they're going to be a problem. So you all may be aware that the doctors all went on a protest. They got Black Monday, okay, telling that some of us want to specialize, but if you're only allowed to 2 years, and the extra 2 years is only you're given to some people, okay, for local masters, locally you can do specialization. They call it masters program, okay, or you can go overseas. You can do membership or fellowship program overseas, okay. For the local programs or the overseas program, you must have 4 years of recognized training. So after the Black Monday, which happened sometime in end of June, July, okay, on 23rd of July, the Prime Minister said we are extending another 2 years housemanship. Sorry, another 2 years of MOship, which means in total you will be employed, okay, in the government, and you're paid all this from houseman 2 years, compulsory service 2 years, and plus another 2 years. Altogether 6 years your employment is guaranteed unless you did something wrong lah. Okay, you're not coming to work and disciplinary problems and so on. Otherwise, you can comfortably, we can have up to 6 years from the houseman, 2 years, medical officer compulsory service 2 years, and another 2 years to allow you to do some sort of fulfill the requirement of a training for specialization. And it the whole thing, the license, we call it a practicing certificate. Because there are many types of practicing certificate. They've got this called annual practicing certificate, which says that every year you have to renew, and the only one body does all this licensing of practicing certificate. This is a Malaysian Medical Council.
Doctor, I'm a bit confused about this annual practicing license. You mean to say every doctor in the country got to renew every year?
Yes.
Oh.
Okay. Because they want to know for a government doctor or a private doctor, they want to know whether you are keeping abreast. So in fact, you have we got a CPD point, okay, where continuous professional development program. That means that you must have attended some courses. You should have. Some of the courses are online. A lot of the courses are on free. Okay, and a lot of hospitals as well as medical colleges they conduct. In fact, just last week or 2 weeks back, Manipal conducted international conference, okay, which attracted about 20 points, and you must have 20 points to renew your annual practicing certificate. They wanted to know whether you are keeping ahead. No. So all the general practitioners, everybody, we have to submit, okay, online that you have attended these courses, and each course, depending upon the number of hours, you got 1 point or 2 point. Usually 1 hour is 1 point, 2 hours 2 points, half a day is maybe 6 points. Something like. We had a 2-3 days conference, and we almost got 18 points just 1 day only. Okay, so so it's quite easy to get. It is the same thing with other countries as well. Okay.
CPD hours.
Yeah, we call CPD hours. You should have fulfilled, and then there's for government doctors, they count the CPD by doing ward rounds. Is counted. Okay, we have done ward rounds. You have seen patients. You have they all attract CPD points as well, and that's not a big problem. And when you're on the government side, the government will pay for you for the annual practicing certificate. Okay, and if you're in the private sector, okay, then what happens is you have to pay yourself, okay, for the annual practice certificate. It's not very much. It's used to be 50 ringgit, now it's 150 ringgit per year.
Per year. Okay. Doctor, you haven't answered one of my questions. Maybe you would have.
Yeah.
Okay. My question was, with my earlier question not answered is, where are they going to get the fund for them to do specialization? That's one thing.
Yeah.
Okay, one more question, Doctor. Just now you told us that a student needs minimum 4 years for them to get into, for them to qualify for a specialization program. But now the government is extending another 2 years. Can they exit themselves after 4 years, or the last 2 years will be also compulsory for them to stay?
Okay, there are many exits on the way. Suppose you are not able to fulfill your housemanship satisfactorily, complete housemanship by 2 years. Okay, I told you before that they could extend you up to the maximum of 3 years total, and still you are not competent. Okay, no use you becoming a MO. Okay, so what happens is that they will ask you to exit. Okay, that's the first exit. So when you exit, what happens is that since you have not finished your housemanship satisfactorily, even after 3 years, you cannot practice medicine, clinical medicine. You cannot see patients. You cannot open a GP clinic. Okay, but if with that qualification, because it's like any other degree, You can do something like hospital management, or you want to go to a pharmaceutical company. Okay, they need somebody with a medical undergraduate certificate program to do it, or some research and so on. You can, but clinically, to treat a patient, to examine and treat a patient, you must have completed the housemanship within the 2 years or a maximum of 3 years. Okay, then I said the compulsory service of 2 years medical officers. Again, if you have done very well in the medical during that period, okay, and you have shown interest in a particular specialty. For example, you liked orthopedics very much, okay, and you have attended some courses on orthopedics, and you're when you are in the orthopedic department, the orthopedic consultant gives you a very good report. He is very interested. Okay, he should be, and his report says he should be given a training place. Okay, for orthopedics, since he's very interested and he's very hardworking, and he is taking a lot of interest. And sometimes you can sit for overseas examination, part 1, during that MOship, first year, second year MOship. You can do. Once you have shown that kind of interest, what they will do, the government, the Ministry of Health will do is that they will post you to an orthopedic center which is recognized for training. Okay, either for masters or for external examinations like FRCS or MRCS or MRCOG in UK. Okay, also you need to be trained in that discipline, not just you must be trained in the discipline where you want to sit for the exam for 4 years. Okay, suppose if you want to take specialist in obstetric gynecology, you should have done 4 years in obstetric gynecology. Okay, that's important. And not every hospital, it is a recognized hospital. Malaysia has got a number of recognized hospital where all over the world is recognized as that you can sit for an external examination. Okay, and the same thing with Malaysia. So the money is something like this. If you are sitting for an external examination, UK examination, you have to pay the fees by yourself. Government does not pay. Okay, examination fee. Okay, they only recognize the training that you had in Malaysia, but the examination fees that you have to pay, okay, that may be £1,500, £1,500, maybe around that thing. The government does not pay for that. If you are doing a local master's program, then of course you don't pay anything also. Almost nothing. It is a government sponsors you. The government sponsors you. You don't pay anything. Okay. If you are going to do a FRCS, like what I did, is that if you got a training here, you fulfill all the requirements to sit for the exam. You only pay the examination fee, and the part 1, part 2, all you can sit. Some of the part 1 and all, you can do it in Malaysia itself. Okay, and the last part only you may go to UK. Okay, for 1 day or 2 days, and sit for a practical exam there.
Okay, Prof. Prof, I've got some questions on specialty fields.
Yeah.
Okay, you've got 40 over experience in this line. So let me throw a question to you. Some 20 years ago, or during your time, early period, you told us that you were just in 1 year for housemanship. How about those days specialty fields compared with the new trend? I come to know that there are some sub-fields of specialty, and that's one question. Another question is, which specialist field would you recommend to students after which they can have let's say their lifestyle, and can the student choose a specialist field based on his lifestyle, his interest, and can he choose based on his higher possibility of income? And how about the shortages or oversupply of some specialist field in Malaysia?
Okay, this medical specialty has morphed into so many new specialties as well as subspecialties. When I did my fellowship, Okay, in surgery meant it's a general surgery plus orthopedic surgery. They both were together. So we had the same qualification. We sit for the same exam. Okay, so I can practice both general surgery as well as orthopedic surgery. Then what happened? I think 1 or 2 years after I passed out, they separated general surgery from orthopedic surgery. Went off. Now we come back to general surgery. General surgery, now you got different exam for plastic surgery, different exam for urology, that's a kidney surgeons, different exams and training for pediatric surgery, different exam for colorectal surgery. Okay, so what happens? You become already, you start off with different specialties, okay, and so on. If you go to orthopedics, you got under orthopedics, they've got some specialties. There are only specialists only for hand surgery. There are specialty only for leg, foot surgery. There are specialists only for knee surgery. There are specialists only for spine surgery. Okay, and so on and so forth. And say when I did my fellowship in after my general surgery, I went on to do my neurosurgery, both at Singapore and later at Oxford. And that time, neurosurgery was just a subspecialty. Now we have a sub-specialty. Under neurosurgery, you got vascular neurosurgery, you got pediatric neurosurgery, you got tumor neurosurgery, okay, you got minimally invasive neurosurgery, and so on. So what happens? Well, the whole world has gone to this subspecialty, whereas if you take Malacca, for example, where I work, Malacca Hospital is, I think, second or third largest number of beds in the country. We don't even have a neurosurgeon. Even don't have a general neurosurgeon. Forget about the subspecialty. That's why I need to tell you, we are very, very short. We don't have so many specialists in a big hospital like even Malacca. Okay, and in fact, if you want to see the what do you call, there are 40 over specialities in Selayang Hospital. Okay, we only have 27 major hospitals in the country. Okay, with the 40 specialties in Selayang Hospital. However, out among the 24, if you go to Elizabeth Hospital in Kota Kinabalu, it is a major hospital, no, for training. They only have 10 specialties, for example. And in fact, even from the 40 specialties and so on, too little. They have got about 70, 80 kind of specialties. Okay, so we are. What happened is that on the top, so specialty field, we are very, very short, extremely short, disgracefully short. But at the entry level, as a house officer's job, as your entry level, we have a rush there because we don't have many positions. Okay, to have a houseman training post, you must have a specialty hospital with minimum 10, 15 special specialties in that hospital, and we don't have enough of the hospitals. That is why housemen cannot go in. So now the government is taking a lot of pain and interest, okay, to build more hospitals so that the housemen they can train the housemen and the medical officers and so on and so forth.
Doctor, there are some perception among my friend doctors, and dentists. I have got some friends. Some claim that dentists would earn higher than doctors. But isn't dentist just another specialist field of medicine? And how come they claim that they can earn higher than doctors?
You are talking about private practice, I think, because whether you are a dentist or a medicine, okay, in the government side, you come under scale called UD scale, capital U, capital D. U stands for Perubatan, okay, and D stands for dental, okay. So what happens? The same scale only they have. Whether you are a medicine or a dental, you have the same scale of pay, not $1 less, $1 more. However, the medical people earn more because they got a lot of allowances. critical allowance, call allowance, that allowance, and so on, which will come to about almost like their basic pay lah. Okay, so that the dental don't have that. Okay, so even though the basic pay is the same, but when they come outside, okay, private, okay, without being doing a specialty, dental specialty, there are a lot of dental specialties as well. If a normal person without a dental specialty is possible to earn more than a medical guy without any specialty. Okay, but if we're talking about once you're a specialist, I think the amount of money that people earn can be anything. There are people who earn 50,000, 100,000, 200,000 per month. Okay, for medical specialties, which a dentist cannot earn.
Oh.
Yes, Barbara.
Barbara, something you want to?
Yeah, I just wanted to add. I mean, I've been putting students to medical and dental school for over 10 years now, and one thing I've observed is, while both are very, very noble healthcare professions, it's actually very different professions. I always ask students who want to go into dentistry that they need to have that passion for the oral cavity, the mouth. And the reason why is when you do dentistry, that's all you work with from here to here. And in particular here, you know, if you don't like it, there's nowhere for you to run. If you don't like teeth, there's nowhere for you to run. You still have to do procedures related to the teeth, even if you do a specialization, oral maxillofacial surgery. It's still to do with this region. If you look at gum disease or oral pathology, things like that, it is still to do with the mouth region. So for a student, it's of course very easy to say, I want to help people. I want to be a medic. I want to be a healthcare professional. But you know, a dentist has a more stable life, so I'll go become a dentist. Because at the end of the day, you're doing that job for 8 to 9 hours a day. If you don't like what you're doing, you know, it's going to be a real pain. I mean, let's all take Mr. Thiru. He enjoys guiding students. He enjoys working with each of you to realize your dream. And that's why if you message him at 10 o'clock at night, he will respond to you because he loves what he's doing. And that should be the perspective that students should take. If you want to know whether dentistry is suitable for you or not, start observing yourself for the next 2 weeks. When you meet someone new, okay, or when you're watching TV, a show or something like that, are your eyes drawn to their teeth? If your eyes are always drawn to their teeth, then you have I would say, a very clear-cut passion for dentistry because you have this longing, you know, like, okay, this person needs to brush again, and you want to just take a toothbrush and brush their teeth for them because the teeth is not nice, that sort of thing. So, you know, it's a valid question. Do they make more money? Yes. Having said that, you've got to love what you do. Otherwise, you're going to hate every day of your working life. Back to you, Mr. Thiru.
Okay, as what Barbara said, okay, if you have only undergraduate qualification dental and you compare that to a purely undergraduate qualification only in medicine, okay, it's possible a dental guy might earn more money. Okay, possible. Huh?
Possible.
Yeah, definitely. But if you become a specialist, okay, then they can earn hundreds of $1,000s, which a dental guy cannot make. But what Barbara made a valid point. You asked me the same question: which specialty they should take? Okay, you take a specialty which you love. Okay, that's number one. First of all, okay, because you will enjoy. It doesn't become work. It looks like a play for you. Okay, you enjoy, it's your passion and it's like a hobby. You know. Okay. See if you like a lot of stressful life, you like challenges, you like long hours, okay, of operation, the surgery, and so on. You take neurosurgery. It's not very well paying, but okay lah, can get by. If you want to earn a lot of money, okay, but you won't have a good weekend, but you like surgery and so on, you become a eye surgeon. Okay, you can earn easily 100,000 in a month. Okay, with only 9 to 5 job, and Saturday Sunday you can take rest and so on. Suppose you don't like to see patients because you can't talk, I don't want to do anything, you become a pathologist, you become a radiologist, you become an anesthesiologist. There are so many specialties where you don't have to see and talk to the patient, and all these jobs are usually 9 to 5 jobs. Okay, and not anesthesia. Anesthesia, the surgeon or somebody will call you in the middle of the night, they have to go. Okay, but most of the times the like radiologists and pathologists, they do it only 9 to 5. Okay, so you have to see first of all what is your interest. If you're talking about outside specialty, all specialties will earn money, very well money, and I think nothing less than 50,000 per month or 60,000 a month minimum. Any private hospital, you learn. That's a minimum that you earn.
Thanks, Prof. Okay, I have got another question, Prof. There are also questions I know always being regularly directed to me. How about global opportunities and how to go about it to do 5 years medicine here and get the medicine practicing license with MMC, then attempt for an overseas opportunities, or halfway through or towards the end of the session, whether they can go and take overseas examination. There are also some, some remarks from students. Should I do my housemanship here? Can I do in, let's say, USA? And how does all those works?
Okay, throughout the world, except for USA and Canada, throughout the world, they recognize your degree based on MBBS certificate plus the housemanship training, completion of MBBS housemanship training. So then they consider you as a doctor. Okay, otherwise they will just say you got only a paper qualification without a housemanship is you're not fulfilled, not completed. Okay, so if you want to go to UK, okay, you want to do specialty, you get a job there. Okay, you can do a job if you are planning not to come back to Malaysia. You don't have to once you finish your housemanship satisfactorily, you don't even have to do the compulsory service. You can say bye bye and go back because I'm not coming back. Okay, if you want to, you can go to UK, you get a job. And in UK at the moment is a very high demand for doctors. Okay, some years back when they were together with the European Union, for example, there are a lot of doctors from Italy, from Poland, and all from the European Union. Now nobody is going there because they can't speak the language properly. Even French people can't speak English very well. And whereas Asian people are better in speaking English and so on. So what happens, you can go there immediately after your housemanship. If you're not going to come back, if you're planning to come back, you better do the compulsory service, because when you come back, they ask you to do the compulsory service in Malaysia. Okay. Yes. Whether they don't care whether you did your fellowship, you're done a specialization. Okay, and they'll say no, you went without doing a compulsory service, you have to do compulsory service and so on. Okay,
35, 37.
Yeah, and having said that, there are people who have had a sub specialty and they're given exemption. Okay, you have done this, so okay. However, there are one or two things you have to know. To go and do a training in overseas, like UK, for example, you have to sit for their exam. Okay, they're called a PLAB exam. Okay, which is partly on English language and partly on medicine, basic medicine, as an MBBS doctor should know. I don't think it's a very difficult exam, because lot of courses how to prepare for the PLAB is being conducted in Malaysia. Lot of universities conduct that. One of them is, of course, Manipal also conducts the courses. We bring people who mark for the PLAB papers, Okay, they normally come down from UK, and they'll tell you how to prepare and so on. And the passing rate is very good. Okay, once you pass the PLAB exam, you just those days when I was in Malaysia, I used to get a job. Okay, and I just go to the what do you call, the UK, the consulate, and then there are papers there. They will ask you for a. Once you go there, they'll ask for a job. I apply here for a job to start off, say, on the 1st of August, and I've gone from here only on the 30th of July. I land, and next day I start working. That's the kind of thing, lah. So you can apply for a job from here also. Okay, but you have to do a PLAB examination. You have to pass, and this PLAB examination is not only for us. Even if you are locally UK graduate, you study in Cambridge, or Oxford, Edinburgh, Bristol, or wherever you have passed out, whichever college, you have to sit for the exam in order to practice that. Okay, and Malaysia is going to have that same thing. It is just to keep the standard, to see whether they are okay or not. Because sometimes in Malaysia we say there are certain countries overseas, when they come here, we find the standard is not that very good. Okay, and they do very and there are challenges when they start working. The consultant don't trust the training that they received. So in fact, they all have suggested that we should have an exam. Okay, after that only you can allow to do a housemanship. But at the moment, not yet, but it's on the cards. It will be only for overseas graduates, not for local graduates.
Doctor, before you forget, how about America's USMLE? How does that differ with the PLAB? Sorry.
Okay, the USMLE is actually stands for United States Medical Licensing Examination. That is the abbreviation is USMLE. It has got their program is that you should get a residency program. Okay, suppose you want to become a cardiothoracic surgeon, you must get a post of residency program in a hospital, in a cardiothoracic unit. Okay, you want to do a nephrology, then you must get a residency program in the nephrology unit. Okay, but before that, you have to pass this USMLE. USMLE, there are 2 steps to it. The first step, you can do it as a medical student after finishing your preclinical studies. That means by on the 3rd year, you can sit for the step 1. If you pass your step 1, then you wait for your finishing your year 5 MBBS. And the moment you finish year 5 MBBS, you can sit for step 2. Step 2 got two levels. The first level you can sit in even Malaysia, but the last level you will go to USA. There's a practical exam. If you pass that, then you have to apply for the specialty you want to be trained. Then they will match the program, whichever specialty, and you, when a vacancy comes and they need a people, when there's a vacancy, they'll contact you, then you start working there. Okay, and what we must understand is that you asked me this question earlier: who pays for the training if you're going to overseas? Overseas, you have to pay yourself, but you are earning money there, no? So what is the examination fee? Is very little. So when you're working in UK, for example, okay, you want to sit for your FRCS or MRCS, you are earning good money. Okay, and you not only pay, you can pay exam fee for yourself. You can pay for your next another 5 friends also, no problem. You're earning a lot of money there. So that's not a problem, lah. Same thing with you go to USA, you're earning money there. So you're sitting for an exam there. There, what happens? A lot of thing depends on or your consultant will tell you, okay, you have done well. Okay, the board will certify you. You call it board certified specialties, lah. Okay, like we call it a FRCS, Fellowship with Royal College of Surgeons, MRCS, Membership Royal College of Surgeons, or MRCOG membership, member of Royal College of Obstetric and Gynecologists, like that. So they got a different. Here they're all Royal Colleges. There they call board certified, USA and Canada. USA and Canada, they follow the same system. And having said that, just now somebody asked about the PLAB exam. Suppose you do an MRCS. MRCS is what you call, before do FRCS, there is a course you have to do MRCS. Okay, in my time there was no MRCS. Straight away we can do FRCS. Now what happens? There are 2 years for training you must have for MRCS. If you pass MRCS, you don't have to sit for the PLAB.
Oh, no need to sit.
No need to sit for the PLAB. You can do the MRCS in Malaysia. Okay, you don't have to go to UK at all, and they take it as equivalent to PLAB. Okay.
Okay, Prof. Just one more question, Prof.
Yeah.
Like a student who would want to attempt for USMLE or UK's PLAB, are they going to attempt before they are going to do their houseman here? Or what will be the negative implications?
Yeah, I think we should not burn the bridges, because you may think that you're not going to come back. You're going to stay only in USA and so on. Okay. But I think we can do together. You apply for housemanship here. You join. At the same time, you also apply there. So you can always leave and go if you're not going to come back. Okay. Suppose you're not getting the program that you want after passing USMLE. In case there was a delay of, say, 1 year or 2 years to get a program where you want to be trained. Okay, because there was a lot of demand for the particular field. Why you're wasting your time? You may as well do your housemanship. If you're working, you earn money, instead of doing. So I think you can do both. Yeah. So the Manipal also conducts USMLE preparatory course.
Okay.
In the campus, we bring people who conduct this USMLE thing, and we have got an agreement with them. And they will come and tell you how to prepare for this. And Barbara, yeah?
Yeah, so Mr. Thiru, just again to answer that question, the exams, whether it's PLAB or USMLE, you can actually do it while you're doing your MBBS. Oh. Now, I'm going to put a qualification to this. Your MBBS is a very, very busy program. Okay, so if you're doing very well in your MBBS, then yes, you can consider to concurrently take your various exams. Yeah. So
concurrently during the 5 years, you mean?
During the 5 years, yes. But you cannot do your part 1 until you finish your preclinical, because you don't know enough. So once you finish your preclinical, you can do your part 1, whether it's PLAB or USMLE. Okay. Now USMLE gives you 7 years. So you start part 1, you have 7 years to pass part 2. Yeah. So you could say that, okay, part 1 is preclinical knowledge, theoretical knowledge. After I finish my preclinical, I'm going to take my part 1 exam because the knowledge is still fresh. You can do that. Typically, we encourage students to do it later on, because knowing the theoretical knowledge, the preclinical knowledge is not good enough. Yeah, you must have some clinical exposure. So typically in Manipal, our students do it from semesters 8 onwards. So they normally do their part 1 in semester 8, okay? Because semester 9 they have their major exams. So semester 9 they cannot straddle 2 exams, and then they do their part 2 in semester 10 or immediately after they graduate. As Prof. Nachiappan said, we actually run training programs because the syllabus is the same. The syllabus for these exams are the same. It's just like our students who took SPM and they need to do ulangan, the timing is not right, they do the IGCSE biology. So as you know, syllabus is the same, but the way they ask you questions and the expectation of answers is different. And that's why you need to go for some kind of tuition. So we tie up with the key providers from the UK and US to actually conduct the classes for our students. These are paid classes, but we have that. So, you basically could say that, okay, I'm going to earmark myself. So for more information on the PLAB or USMLE, I've actually put in the chat box a YouTube video. We just did a briefing with our two providers last night on Zoom. The video is available on YouTube, and I've just shared the link. So do listen to that if you have that interest, okay? Because I think there are other areas that Mr. Thiru wants to address. Back to you.
Thanks, Barbara. Prof, back to you. Okay. Do you think studying medicine everywhere? Okay, there are so many colleges and medical universities in Malaysia. Can you name especially any specific university which, to your knowledge, because you're 40 years, more than 40 years in this field, which you can name a university which has created the most number of specialist doctors in Malaysia? And if it is so, why and how?
I believe that Manipal is the one which has produced the most number of specialists in Malaysia. Okay, and among the specialities actually is neurosurgery, non-neurosurgery, because surgical disciplines. Okay, are the highest. Okay, one of the reasons why this also I believe. That's because we got a culture of cadaveric dissection. Okay, it's very strong in the Manipal culture. Okay, that means we have got lots of bodies. Okay, which the anatomist will dissect in front of you. You will handle those dissected parts. You can hold the nerve. You can hold the muscle. You can hold the ligament. You handle. You touch the brain. You touch the organs, you move about, kind of thing. This kind of practical experience is lacking in other medical colleges. Like when I was in University in Malaya, there were quite a number of bodies which are undergraduates were handling, okay, dissected bodies. But now what has happened is that they've kept the bodies only for postgraduates, okay. And undergraduates, they have only got a plastinated specimen, okay, which means like a plastic specimen, okay, which is nothing like a real one, okay, and which you can detach your liver and put back the liver. No, that's a kind of thing, okay. It doesn't. It is definitely cannot replicate a real body. No way. So because of this kind of cadaveric dissection culture, okay, I think they get this interest in the human body and the human function thereafter, okay. And we are very strong in our when we started Manipal in India, okay. Now the whole program is here. We have brought lock, stock, and barrel. What is in India, we brought it here because they had a very good anatomy museum, one of the best in Asia, one of the best in pathology museum also, kind of thing. So we are when it became a university here, we are replicating the same kind of facilities and resources here, okay, because we know that this has helped us, our students, to produce a lot of specialities. That's number one. Number two, why we're having so many specialists from Manipal is that every hospital you go, there'll be at least one head of department or several consultants who are from Manipal working there, who will take care of you, who's an alumnus. They know, oh, somebody is coming from Manipal, I'm going to take care of you. They guide you to become a specialist. They'll tell you, do this, no, don't do that. So every hospital, there are people, okay? If you say, in fact, if you go to University of Malaya, the head of department of accident emergency is from Manipal, Malacca, Manipal, okay? The second man to Director General of Health, okay, Norisham, is from Manipal. Okay, he is doing a lot of infectious disease specialists. Okay, kind of thing. So there are so many of them everywhere. Okay, and because of the support given by the alumnus, and our alumnus is very, very strong. We come out with our own magazine. We come out with every Monday. There will be one alumnus who will tell you how to prepare for specialties. Barbara can tell that, okay? You can go to YouTube, okay, it's all uploaded into what you call how I became colorectal surgeon. No? Somebody talks. How he became a neurologist, not a neurosurgeon, neurologist, because somebody talks. How he became this, and so on. So this kind of culture among the alumnus of the Manipal is very, very strong. I never seen one like that in any other place. Maybe that these are the reasons why we have a higher number of specialists coming from Manipal.
Thanks, Prof. There is a question by a student, Saktivelu, in our chat box. So, after how many years I can open my own clinic?
Okay. You are not allowed, if you are going to open your own clinic in Malaysia, you should have finished 2-year housemanship and 2 years compulsory service. Altogether 4 years post qualification. Unless you were quite see, this a disadvantage or advantage, I'm not sure. You just managed to do your housemanship well, okay, but you are screwing up on your MO-ship. They will terminate you. You say no need to do a compulsory service, you can open private practice, because since you have completed housemanship.
Oh. Okay, Dr. Prof, there is another question from Mr. Tamulvanan.
Yeah.
Tamulvanan is my friend for last 12 years. Okay, he's a teacher in second school.
Yeah.
His children, his son is studying in Manipal. That's a question. Okay,
Yeah.
thank you very much for your effort. Good job, sir. Please, okay, this one. That's another one. Same. He's asking, Tamil is asking, after completing 2 years of housemanship in Malaysia, okay, from Manipal, can they become MO in overseas like Australia and UK? That is his question.
Yes. You can. You have to sit there for Australia. Also, they have an exam, okay, which you have to pass. You can go there, okay. And what I understand is that Australia also is nowadays the positions are not so many open, but USA and UK, plenty of positions open. Okay, and they just can't have enough. Okay,
you're telling that there are opportunities for
yes, you can work. You can work anywhere. See, I was very lucky in the sense that I was able to work in when I was in UK. I also had time off to work. Once I worked for about 6 months in Athens, okay, Greece, and I also worked in Kaloniska in Sweden. Okay, for my interest was just to see country, and I want to look at Scandinavian countries and so on. So it was an opportunity, So actually, once you pass your MBBS, you are getting a fellowship. You have plenty of opportunities to work in any part of the world. Plenty. You become a global doctor.
Okay. Okay, Prof. Okay, it's already 9:08. I'd like to open the floor for students and parents. I'm sure they have got their own questions. Maybe students, you all may start directing your questions direct to Prof. If there are any students, parents, are there any?
Hello, Prof.
Yeah.
Sorry to interrupt. I'm Pravinesh.
Yeah.
I would like to have an answer for this question. What do you think about the future of doctors in Malaysia, Prof?
As I said, we are very, very short of specialists. If we are talking about the MOs, we have enough MOs, okay, at the moment, because see, our country produces about 2,000 over doctors, and another 2,000 were coming from overseas. Okay, so there is a difficulty in getting into a housemanship program, okay, in Malaysia, because of the about 4,000 over doctors coming. However, in the last 2 years, to my knowledge, almost nobody went overseas to study medicine, fresh graduates. The only people who went overseas are those people who already before the COVID situation, who are studying. They are still studying, okay, even though it's online. Okay, whether there are people in UK still in Malaysia studying online. Okay, and things like that. So there are no fresh. So what is going to happen now is, since you're asking about the future, in about 5 years' time, you will find only half the graduates are going to come to the workforce, because the overseas graduates are almost going to be non-existent. Okay, for a long time after this COVID is going to be there at least for another 2-3 years, and thereafter to pick up people to go overseas, it may take another 2-3 years. So when you come out, okay, I think that we have opening even for junior doctors immediate employment. Okay, and of course we are also building more hospitals and so on, because the only reason why you are not able to build more hospitals is we don't have enough specialists to man the hospital. Okay, it is a catch-22 situation, yes, we are very, very short. I was just telling that emergency medicine specialists, we need 840 or 870 or something like that. We only have about 12. For example, one specialty. Okay, and as I told you, there are so many. Even Malacca Hospital, General Hospital, is such a big hospital with 1,200 beds. Okay, 1,100 beds. So, but they don't have so many specialties. Don't have a single specialist. Okay, you don't have a colorectal surgeon. You don't. We had a hepatobiliary surgeon, is gone. Okay, pediatric surgeons on and off. I heard one pediatric surgeon just came now. Okay, he was not there for last year. Whole of last year, no pediatric surgeon, no neurosurgery. It never had neurosurgeons. Okay, urological surgeons never had. Okay, because you don't have enough specialists. Okay, so your feature is that if you are going to must take a specialty, there is a dire shortage of specialists in the country.
Prof, I have read, in the media, the statements from last few, this Menteri Kesihatan, the complaint is on oncologists.
Yeah.
Really terrible shortages.
Yes. So we don't have interventional radiologists. Okay, very, very short. Okay, we don't have so we had 2 people. They were trained to do hepatobiliary transplant. They call transplant surgeons. Both of them left, and now Sungai which is supposed to be a transplant center, is closed. Okay, because we don't have. Okay, when I was at the University Malaya University Malaya, I was alone running the neurosurgery department. Okay, and when I left, okay, for the next 3 years or 4 years, the neurosurgery department was closed. Now they got 4 or 3, I'm not sure. Okay, but they closed the department. So every neurosurgical case is sent to GH care, not to University Malaya Hospital. Okay, so it's really short, very short.
Okay, students, other questions from students? Parents would want to know more from Prof?
Excuse me?
Yeah.
I have a question. Actually, what is the difference between MD and MBBS?
You're talking about Malaysian program. Some universities will give you MBCHO. Some universities will give you MD. Some other university called MBBS. It's the same thing, different names. Okay, it's an undergraduate program. Different university, they call it differently, but the syllabus is the same. And no difference. Your salary scale, your employment, everything is, they all, MBBS is an old term, but some of them use it as a Latin term, somebody, the doctor of medicine, all kind of things, is the same. No difference.
No difference. Students, any other questions, please? Such a good question just now from the last student.
Mr. Thiru, there's some
hello,
in the chat box as well, Mr. Thiru.
Yeah, sure. Rennie, it looks like you wanted to raise.
Hi, sir.
Yeah.
So the PLAB and USMLE, right? Is it only for MBBS students or it also applies for BDS students?
MBBS only.
Okay, thanks, sir.
Okay, there's a question from Kamaleeswaran. Sir, is it better to do medic in local or private? I think the word he used, local government.
You are talking about undergraduate.
Yeah, of course.
Okay. Okay. I tell you some statistics. Okay. What happens is they did a study that was in 2018, I think 17. Okay, 18. Who are the people who cannot finish a housemanship? From which colleges they come from? Okay. And what they found was in Malaysia, I'm talking about local universities, there was no difference between public university and a private university who were not able to finish housemanship. There was a small proportion of people, okay, who were not able to finish housemanship within 2 years. So they took another extra third year. Okay. So whether it's a University of Malaya student or it is some other private university, there was no difference. Okay, the same. However, there was a lot of difference between overseas, okay, and Malaysian universities. For example, Indonesia, they had, and also Russia, they had 60% of the people not able to finish.
Oh.
It was Poland, Russia, and Indonesia. Okay, they were not able to finish up to 60%. This is been mind-boggling, you know. So what happens as long as universities and colleges within Malaysia, there's no difference. Okay, there's a small proportion of people who took one extra year to finish their housemanship.
Doctor, there is a very popular question here.
Yeah.
Why are there so many doctors in Malaysia but so few specialists? Is it because any system, something wrong with the systems in the medical field? Why is it so?
This is again the same problem. To able to do a specialty, you must have enough hospital with enough specialists.
Oh.
Then only you can take students for specialty training. Okay, so there'll be very limit. Suppose you want to do plastic surgery, there are only places for 3 seats or 4 seats per year. Per year. So because they don't have enough people to train them. Okay, this is by a simple answer. It is like a egg and chicken issue, is it? See, so you have to solve somewhere. This problem is how the UK is solving is UK is running because they're recruiting people from India, they're recruiting people from Malaysia, they're recruiting people from everywhere to run their program, specialty program. Okay, whereas we are not recruiting, we are trying to make do with our own graduates, and we're not having enough to train them. If we have enough people, they would have opened more hospitals, specialty hospitals also.
Yeah, that means very simple to say we don't have the lecturers.
Yeah, we don't have the lecturers or the teachers to train them.
Yeah, that's right.
So we're all hoping that you all will specialize and become teachers and train more people.
Prof, there is another question from a student, Yalini. Annasalam, I know the parent and the student, actually, Yalini. Annasalam is a teacher.
Yeah.
Okay. She's asking if she were to, let's say, if a student were to go to Sweden, are they supposed to learn the Swedish language?
Yes.
Is medicine taught in that mother language there?
Yes. Yes, you're better off there. Okay, of course they all can speak English, but the thing is that there is an interaction with the patients, interaction with the, so it's better to know. So I see in my time when I was in Kaloniska, I had an interpreter because at my level is okay lah. Okay, but if you're asking if you're an undergraduate, you are going to see so many patients. I'm not saying so many patients. I'll be seeing maybe 3, 4 per day. So your nurse will interpret and so on. Whereas if you are an undergraduate, you're seeing a lot of patients. In a clinic, you may see 40 patients, 30, 40 patients. It's better you be able to communicate.
Better, yeah. Okay, now it's coming to close to 9:20. Okay, if there are any questions, let let's have a last question because we have taken quite a long time from Prof. Can we have a last question?
Sir,
Yeah.
all the opportunities explained just now for was more for MBBS students. So
Yes.
BDS students have those kind of opportunities.
BDS, I think Barbara should arrange one.
Oh yeah. Today the
Yeah,
whole
I was thinking about it. I'll speak with our dean, Professor Dr. Abdul Rashid. He is our dean, and we'll try and secure some time to do a session similar for BDS. He's got equally long experience like Prof. Nachiappan. Prof. Rashid has the additional experience in the sense that he was the dean for the dentistry faculty at USM before he came to Manipal to open. So if you're a dental student and you're tuning in, stay tuned to Iraimalar. We'll see when we can get hold of Prof. Rashid and do a similar session.
Prof, there is a question from Kashmira.
Yeah.
That's me. Okay, her question is her SPM. Okay, subject. She has got a shortfall. One of the science subject, biology. She has got a C, and we know that she cannot do medicine here unless she can improve her SPM science subject, biology.
Yeah.
But there are so many agents, placement agents who
Yeah.
claim that you can go to Russia, you can go to Indonesia, you can do MBBS there, come back to Malaysia, do practice medicine without you have, overcome the SPM subject issue. How far it is true?
It's not possible.
Not possible.
Not possible because you will not be able to get registered by the MMC. You will not get a certificate. In fact, it's a very sad thing. Something happened. There were about I think quite a lot of people. Okay, maybe up to 50 or 60 medical students who are studying in different medical colleges in Egypt. They're all government scholars. Okay, and these government scholars who have gone there, what has happened was they went after their SPM. Okay, they're supposed to do your foundation. Okay, in there, then you go for the program, MBBS program, 5 years. So what has happened was they incorporated the foundation into the MBBS program, and they did only 5 years. Earlier was 1 year foundation and 5 years MBBS program, for example. Okay, so altogether total 6 years, right? Okay, I'm just telling you an example. Altogether 6 years. But when now the first cohort of the students, some are studying in the 3rd year, 4th year, the one who finished the exam, they passed, they came here, already going to be 2nd year, they are still not employed. They are government scholars.
And yet not employed.